Dr. Wheelis, just letting you know, we do have time. So I know we went over just a few minutes, but you have plenty of time. We had one of our presenters is sick, so we'll have some catch up time. So feel free to take your time with your full presentation. You don't have to rush through, since we'll have a little break halfway through that we can catch up if we go over a little bit. So, but yes, Dr. Wheelis is local ENT, is going to be talking about chronic sinusitis. So look forward to having him on and hearing his presentation. On him for the past number of years, and just, yeah, he's a great individual, great physician, great ENT, and also just as an expert in this area. So looking forward to learning about chronic sinusitis. So Dr. Wheelis, the floor is yours.
Great. Well, Dr. Chesney, thank you so much for having me today. Can you see and hear me and see the screen and everything?
Yes.
Awesome. Awesome. Well, again, thank you very much for allowing me to be here and allowing me the opportunity to speak about what is my favorite topic. My wife calls me the boogie doctor, and I represent that proudly. This is my passion within medicine. So again, thank you for yourself, and thank you for everyone who's here. I hope to convey a little information today that others may find helpful. So let's talk a little about the sinuses. What are they? Well, essentially, they're air pockets built within the skull. In their healthy state, they're lined by a very thin mucosal layer. Mucosa is like the lining of the nose and the sinuses, and they're full of air. We all have 4 matched sets of sinuses, which you can see here. The frontal or the forehead sinuses. The ethmoids are a series of small sinuses that are positioned in between the eye sockets. The maxillary sinuses are in the cheeks. And then the sphenoid sinuses are between the eyes, but they're kind of far back, deep within the head at about the level of the temples. Why do we have these things? Well, evolutionarily speaking, we think there are probably 2 reasons. Number 1 is they lighten the weight of the head. The average human head weighs about 26 pounds. And as you might imagine, that puts a great deal of strain on the cervical spine as well as the neck musculature. So any break we can get, we'll take it. And the other thing is we think they serve as crumple zones, essentially. So that if you are in some sort of impact situation, the sinuses will break first, hopefully protecting your valuable brain inside. So if a normal sinus is an air-filled cavity, sinus infection develops when the system gets out of whack. Common symptoms of sinusitis I have listed here. People often complain of pressure and pain over the sinuses, headache, nasal congestion, postnasal drip is a common one. Sometimes that causes kind of this routine chronic cough. Thick nasal drainage from the front of the nose. It can be all kinds of colors. Fatigue, fever, sometimes pain in the upper teeth, particularly the molars and the premolars, sore throat, decreased sense of smell is very common. And then oftentimes people kind of have a bad breath from some of this chronic drainage. Experts estimate that about 37 million people are affected by sinus problems every year. That makes it one of the most, if not the most, common affliction in America. Now, interestingly, that number is probably even higher because there's so much symptom overlap with allergy stuff and the common cold that a lot of people just kind of sit at home. They tough it out. They don't even go and seek medical care. So there's some people that we're not even trapping in that 37 billion number. It's important to recognize that sinusitis is a spectrum of disease. Most of these infections are acute infections. Those tend to be viral infections. Those are going to run their course no matter what you do. They tend to last 1 week, 2 weeks. Once they start to last longer than 7 or 10 days, we worry about bacterial infections. As symptoms kind of hang on longer, it goes through this gray phase that we call subacute sinusitis. And then once symptoms start to hang on for months on end, we call that chronic sinusitis. For the chronic sinus sufferer, we've learned that it's a completely different disease process. Chronic sinusitis is a combination issue. It's a combination of swelling that affects the lining of the sinuses. Well, what that swelling does is it blocks off the drainage passageways for the sinuses. So that's what I have demonstrated here. That first slide shows that the lining of that cheek sinus, the maxillary sinus, has become thickened. And the second sort of zoomed in bottom right picture, you see that that thickened lining has blocked the drainage passageway. And then what happens is the mucus that we all make throughout the day builds up within that sinus and it can't escape. We all make about 1 liter of mucus a day. Now, normally it's thin, it's healthy, it's clear, and we end up swallowing it. But if it gets trapped in a sinus, it just sits there. It gets stagnant, and that's an opportunity for infection. And once you have that infection, well, of course, that makes the swelling even worse, which makes the blockage even worse, which makes the infection even worse. It makes the swelling. So you get in this vicious cycle. So a common way that people present to us when they're dealing with chronic sinus issues is this kind of roller coaster presentation where they live with this baseline level of symptoms throughout the year. But several times throughout the year, they may have little spikes in their symptoms. Well, maybe you go to your doctor will give you some antibiotic medication. Symptoms get better, but they don't quite go away. And then it's just a matter of time before the symptoms come right back. Maybe you get another antibiotic therapy. Again, symptoms maybe get better, but you just repeat the roller coaster ride. Well, what about allergies? We live in East Tennessee. That's a common thing around here. And as you see in this slide, there's a great deal of symptom overlap between sinus infections and allergies. You know, as a patient comes in and tells us their story, sometimes that can really lead us in one direction or another. But sometimes it can be really hard to tell. Is it 60% allergies, 40% sinus infection, 70-30? So in these cases, what we really tend to do is we rule out sinus infection. That's the most dangerous. That's the thing that can really have downstream implications. And then once we have the sinuses totally cleared, we can confidently say, okay, everything that's left, that's allergies. And then we can get aggressive on the allergy front as well. You know, I should say, it's pretty common for me to see folks who come into me and they've been treated for allergy stuff for years, and it's just not getting them any better. And as we dig in, we find out they've had a chronic sinus infection all along. You can see how that would happen. Again, there's a lot of symptom overlap here. Other common variables that can sort of masquerade as sinus and allergy problems, things like a deviated septum, enlarged turbinates within the nose. The nasal septum is the middle wall of the nose. It's the piece of your nose that kind of separates the two sides. It's made up of bone and cartilage, and in some folks that can be deviated. In fact, in about 70% of individuals, it's deviated to some extent. If it's bad enough, it can cause nasal obstruction. The other thing that can mimic that is enlarged inferior turbinates. Here in this chart, you see the turbinates hanging down from the side walls of the nose. Those are normal structures, and they help direct air as it enters the nose from the front to the back. But what can happen is those structures can become swollen, and as you might imagine, that just eats up valuable airway real estate. So people who have these problems often complain of nasal obstruction. And I should say, these problems aren't mutually exclusive. You can have a deviated septum, enlarged turbinates, allergies, and sinusitis, or any combination of the above. So when is it time to come to an ENT? Well, when the chicken soup isn't working. You've had long-standing chronic symptoms. Sometimes you're getting several rounds of sinus infection per year. You're going to the doctor frequently. You've been on multiple rounds of antibiotics. Maybe you've had prior surgeries in the past. Or maybe you're just having nasal airway or breathing problems. If you recognize that roller coaster, it's probably time. What's an ENT visit like? Well, much like any other doctor visit, the bulk of the visit is really taking the history. What the patient tells us is the most important thing. What are the symptoms like? Did they come on at certain times of the year? What have you tried in the past? Have you had allergy testing? All those things are important things for us to know so that we can help guide decision making. And then we do a basic exam. At an ENT office, of course, we'll focus on the neck up. The big thing that we'll do that's probably different than what your primary care doctor does is we want to take a really good look in your nose. And the way that we do that is with a nasal endoscope. Now, essentially, that's a little bitty camera. It's probably about the size and diameter of like 2 of the little coffee stirrer plastic straws. And that allows us to look from the front to the back of a patient's nose. We put in a little numbing spray first. Patients do great with this. Everybody's anxious about it, but everyone does really well. But that allows us to visualize both the nasal passages, the septum, the turbinates that we've talked about, in addition to the sinus drainage passageways. Most of the sinuses kind of funnel down into one common chute. So we're looking at the chute to see, do we see any evidence of foul drainage, or are there any polyps, anything like that? And if the patient's had prior sinus surgery, that would allow us to look into the sinuses themselves, which can give us a lot of valuable information. So here's an example of the view that we might see with a nasal endoscope exam. The first on the left is a fairly normal exam. Now, this is looking into a patient's right nostril. So what you see hanging down from the left side of that little circular picture, that's a turbinate. On the right side, what you see is the nasal septum, the middle wall that separates the 2 sides of the nose. Now, compare that to the picture on the bottom right side of the screen. That is a picture that shows a large polyp. And as you might imagine, that patient came in with significant breathing problems. So once we've completed a thorough workup, we decide on a plan. And every one of these plans is unique, tailored to the patient's individual situation. But the first line of therapy is always medical. We never jump straight to surgery. We want to give you your best shot of a medicine-only cure. But remember, this is a combination problem, so we'll need a combination treatment plan. We got to address both the infectious organism, the bacteria that's probably causing this, and the swelling that has resulted. So combination problem, combination treatment. Generally, that means some combination of antibiotic, steroid, of course, the antibiotic for the infection, the steroid for the inflammation, sometimes sinus rinsing, and then possibly doing some work on allergies as well to further control that inflammation if we think that's a big part of the overall situation. But here's the trick. We want to see you back, because what you, the patient, and we, the doctors, want to know is, how did we do? Is there anything left? Did we get it? So that follow-up visit at the end of treatment, that is the most important part. That's really where the rubber meets the road. If medicine is going to clear this, what we do as a first-line therapy ought to do it. Because once you get to an ENT office, we tend to be fairly aggressive. By the time people get to us, our back's on the ropes. So we want to give you your best possible chance of a medicine-only cure. So at that follow-up visit, it's always interesting to hear what symptoms has the patient noticed? Are things getting better? Have things not improved at all? Have things gotten worse? Did they get better on the antibiotic and now they're starting to get worse again as you come off? Again, we'll probably take a quick peek in your nose with the nasal endoscope, see if there are any changes from that pre-treatment examination. And then usually we'll follow that with a CT scan. And here's a picture of a CT scan. This patient has isolated sinus disease in their what is left cheek sinus. So this is a picture taken like they're sitting across the room looking back at us. So what that means is the right side of the picture is actually their left side. The left side of this picture is actually their right side, because again, they're looking at us. And so what we see is there are 2 eyeballs. The brain is on the top. And this, here we go. This picture actually shows the forehead sinuses, one here, as well as the cheek sinuses. And what you'll notice between those 2 cheek sinuses is the one on the left side, there's a lot of gray in there. So that is thickened sinus lining. And you'll also notice there's kind of a foamy consistency on the top right in there. That is sort of a foam over this thickened lining. So probably some infectious material that's in there in addition to that thickened lining. So at this point, for that patient that we just showed, what we would talk about is a surgery. Again, if the medical therapy that we've tried hasn't fixed it, well, medicine ain't gonna. And so now it's time to get a little more aggressive and to fix the functional problem itself. Now, I think it should be noted that there are a lot of different procedural options out there. Some are in clinic, some are in more the OR surgery center setting, but everything is outpatient. You may have heard of balloon sinuplasty or functional endoscopic sinus surgery. Again, no matter what we do, everything is done through the nostrils. There are no incisions. This doesn't change the shape of your nose. Bruising, black eyes would be really, really uncommon. I tell my patients this is the kind of thing that the day after surgery, if you went to the mall and you were walking around, no one would have any idea that you have had this done. But no matter what the procedure, the goals are really the same. Number one, we got to get that old infection out of there. Essentially, we're hitting the reset button. Wherever that infection is trapped, in whichever one of your sinuses or several of your sinuses that infection has been trapped, we got to release it. And number two, we're really setting the stage for the long term. We want to create large openings into those sinuses that have had problems in the past, so that in the future, when you're faced with another infection, you'll have a great big opening. And so even if you do have some swelling of that opening, you won't get infection locked in there. So you ought to be able to fight an infection as well as anybody else. Now, this picture that I have here, this kind of gives a demonstration of, what we're trying to achieve. In this surgery, we are taking out the parts that are shown here sort of in white with the polka dots to open up the frontal, the forehead sinus, the maxillary, the cheek sinus, and the ethmoids, which are again a small series of individual cells. So what we do over here after the surgery, how things would look, you got a great big opening into the forehead sinus, a great big opening into the cheek sinus, and what used to be lots of individual small cells of the ethmoids is now just kind of one great big cavity. As you can imagine, all of these places would be a hard location to lock an infection after a sinus surgery. What's the recovery like after a sinus surgery? Well, in general, I ask my patients for 1 week to do no heavy lifting. Depending on the extent of the surgery, you may have a little bit of dissolvable packing. And I ask that you do frequent sinus rinsing. I would see you back 1 week after the surgery. Any of the dissolvable packing that we've put in that has not been rinsed away, we'll go in with a little vacuum cleaner and we get that stuff out for you. And this is a kindler and gentler thing. People often come to me with stories of friends or family who've had sinus surgery in the past, and they relate the story of like going to the circus and the clown who has the ribbon in his mouth just pulling and pulling. It's not like that anymore. It's not like that anymore. It's a kindler and gentler thing. Depending on the extent of a patient's sinus disease, we'll then follow them up regularly to make sure that they get their money's worth out of the surgery and they don't have recurrent infections, everything heals up properly. And that follow-up schedule will be determined by, again, the patient's original presentation. So as we come down to the end here, I think we'll have some time for questions, but I really just want to hit a couple key points. Again, there's a great deal of overlap between allergies and sinusitis. But if you are struggling with this type of symptom, it is not a normal part of living in Tennessee. If you've been having repeat infections, you got allergy symptoms, nasal obstruction, you feel like you've been on that antibiotic roller coaster, someone's told you have polyps, or even if you had prior sinus surgery, you don't need to suffer. Please allow us to help. Allow us to help. If any of this stuff sounds like you, please don't hesitate to reach out to us. I work at ENT Consultants of East Tennessee. Here is our office phone number, as well as our website. We've got locations at Park West, Fort Sanders, as well as in Lenoir City at the Fort Loudon Medical Center. So thank you very much for your time. Appreciate you guys. If there are any questions, I'm happy to answer.
I believe you had a question in the Q&A, Dr. Wheelis.
Oh yeah, okay.
Good questions.
About the neti pot and the saline rinses. Absolutely. So the saline rinses are great. ENTs really stand by that. That is a mainstay of treatment, both for folks who are suffering from chronic sinus problems as well as allergies. When you think about it, your nose is like your air filter. Its job is to catch those particles in the environment that you're allergic to. So by using nasal saline, essentially you're cleaning the filter. You are stopping those particles before they can really set up and start the inflammatory cascade that produces all those annoying allergy symptoms. So from the allergy standpoint, it's wonderful. From the sinus standpoint, it can help rinse out, again, any bacteria or viruses before they really take hold. Again, we also use it for folks who have sinus infections, because once we open those sinuses up, we want to keep them rinsed out. Doing the rinse keeps the nasal mucus that we make thinner, which allows the little cilia, the little beating flagella that line all of our sinuses, to beat more effectively and to move that mucus around more easily if the stuff is thinner. So we love the neti pot. That same company, NeilMed, that makes the neti pot, also makes a sinus rinse bottle. Personally, I find that a little bit easier to use rather than having to use the genie pod and wait on gravity. You just get to lean straight over the sink. It goes in one side, comes out the other. Again, I think that's a little easier to use, but whatever you do, nasal saline is a great treatment. It can prevent a lot of problems. The next question about natural remedies. There's not a lot of great data on this. I do actually have a couple bonus tips as a slide in case somebody asks something like this. So thank you, Rhonda. And so we've already talked a little bit about the NeilMed Sinus Rinse Kit. Again, since so many of our local problems here in East Tennessee seem to be allergy driven, even if allergies are just kind of setting up and causing that inflammatory state that puts people at risk for chronic sinus disease, some baseline allergy therapy is often a good thing to try. An over-the-counter antihistamine such as Allegra, Zyrtec, or Claritin, all of those are in kind of the same class. So any of those that you choose, and something like a Flonase can be helpful. Flonase is the topical nasal steroid. It's easy, over-the-counter, and generic. All of those medications are. And of course, avoiding common triggers. So smoking, both of those things aggravate the nasal mucosa. And then again, since everything here is about keeping that nasal mucosa moist and keeping that mucus that you make thin so that the natural clearance mechanism can work at its peak efficiency, using a humidifier can also be helpful, especially in the wintertime when it's cold, dry air outside and you come inside and the heater's on, so you got warm, dry air on the inside. Those can be helpful as preventative strategies. Unfortunately, once things really set up shop and you get into that chronic inflammatory state, we really need to get into a little more aggressive medical therapy. So hope that answers your questions.
Yeah, feel free if you have any other questions to use either the chat feature or the Q&A for Dr. Wheelis about sinus infections, or just I'm sure he's happy to answer any other questions about just ENT in general too. So we're gonna transition here, but again, feel free to continue the dialogue. If you guys are looking for just a great local ENT physician, Dr. Willis is your guy. So I can say that I've had family members that have seen him, and it actually just happened by coincidence that I found out who they were seeing. Is like, oh, they're seeing Dr. Willis, and I was